and my name is Kathy Herco. I'm the Associate Publisher and Editorial Director for the Central Penn Business Journal and for Lehigh Valley Business. And welcome to PA Biz Conversations. What's PA Biz Conversations? It's a weekly video web series that we have online on both lvb.com and cppj.com, where we talk to industry leaders in our community that can share some information that is of news. And today I am happy to welcome Jenny Englerth. She is the President and CEO of Family First Health. Want to make sure I got that right on the title. So welcome, Jenny. Why don't you tell us a little bit about you and your organization, and then we'll hop in on some of the questions.
Great. Thanks so much for having me as part of this conversation. A little bit about myself. So I have a great family that I love spending time with, and I love working in healthcare. I've been doing it for 25 years, working in community health. One interesting fact about my family is that every significant male in my life has the same name, and that's Tom. So if any of my Toms see this, this is my husband, my father-in-law, my father, my son, my brother. So no more Toms in my life. That's my only ongoing requirement.
It can make it both easy and confusing, I would assume.
Absolutely. And as I said, I've really enjoyed spending a majority of my career working in community health in a variety of settings, both urban and rural. And I'm glad to talk to you about the work of Family First Health today.
Give us a little idea of what your market is for Family First Health. Where exactly are you guys based out of? What communities are you serving?
Sure. We have a variety of sites, and we always locate our sites in geographic areas that demonstrate high need. So may have a high rate of poverty, may have other indicators that tell us this is the place where we really need to be as accessible as possible to our population of focus. So we have sites across Adams, York, Lancaster, and Lebanon counties. We have 7 sites currently and serve about just over 26,000 individuals annually.
Okay, excellent. Thank you, Jenny. Let's hop into one of the questions that we wanted to talk about today. That has to deal with this is pre-COVID. We're talking about what are some of the health disparities you've seen in the vulnerable communities, because you are based in the areas of need. What are you seeing? What are you seeing some of the health disparities in that respect?
Sure. I'll take just a second for anyone viewing this to kind of define health disparities. And very simply, that means that if any segment of the population's health is impacted, or their health outcomes are different than the majority of the population, we consider that a disparity. And we want to dig in and find out why that is, what's causing that, and to help rectify that. Because we believe that everyone should have the same opportunity for good health. Historically, so I say historically, so before March, we focused in our center in delivering comprehensive primary care. So we wanted to look at preventative measures. So often in low-income communities, or communities of color, we see children kind of falling behind because they may not be receiving regular well child checks or immunizations. So we see a disparity there. We may see in our adult population a greater impact of diabetes. So we see let's say a higher incidence of diabetes in our patient population than the general population. And probably as importantly, we see more negative effects of chronic illness. So hospitalizations, long-term disabilities than the general population in relation to chronic illnesses. So those are the kinds of things that we focused on. We focused on preventative care and chronic illness, and we still do that. And also then are bringing the current pandemic and situation into our scope as well, certainly.
So you mentioned this was before March, which was before the pandemic hit us. What have you seen after March? What have you seen in relation to those vulnerable communities since the pandemic has hit us pretty hard?
Yeah, so unfortunately, what we see is not necessarily a surprise to us. A majority of our patients are in the low to moderate income range and work what we term high contact jobs. So public facing, essential roles, everything from caretaking in a long-term care facility to maybe working in the grocery store, or a meat producing or food producing industry. So we knew going into the pandemic that those are the occupations that our patients primarily held. And we knew that when many of us were able to make the shift to working from home, to working to home in March, or working at home, that a majority of our patients did not have that privilege or luxury, that they were continuing to work in high contact essential roles. And so we knew, even in our early understanding of the pandemic, we knew that they would be at greater risk. So in our communities, that's played out specifically to be a higher risk or higher incidence of COVID-19 in our Hispanic population in particular.
And what if,
So,
I'm sorry, you go. No, please continue.
no,
Go ahead.
I was just going to say that those long-standing health disparities, some of the things that I talked about previously, we're seeing those just continue into the risk and the incidence of COVID. And oftentimes this becomes more critical because that person may have had a compromised health status going into contracting the virus. And so may have made them more likely to have more significant impact from the virus.
Right. So basically, it's amplifying a lot of the problems that you've already had, and the fact that these guys are frontline workers still.
Yep.
I mean, they can't work from home,
Right.
essentially, like we have the option to. So what are some of the things that Family First Health are doing right now to address that? Like, what are some of the solutions you guys are coming up with or being able to attack it?
Yeah, so we leaned into those things that we know work well. We made ourselves as accessible as possible by any means possible. So within 2 weeks, we stood up video visits for our patients and telephonic visits for our patients so we could connect with them. Our first kind of line of defense was we want to make sure that our patients have what they need to maintain their health. So things like prescriptions that they may need, questions and concerns that they have, we made ourselves as accessible as possible to manage those issues. Shortly thereafter, we started incorporating testing into all of our sites so that we're able to offer testing in our community-based offices and places that maybe people are more likely to trust, be familiar with, come out and see us. We may speak their language. We may have cared for them for a long time. And so the process of going through understanding their risk for COVID and getting tested, we tried to make that just a little bit easier. So that was kind of the second line of defense. And then as an overlay to everything that we've done, we've made sure that the materials, the communications, the messages that we've offered, the outreach to our patients is both in a language that they read, speak, and understand, and in terms that they read, speak, and understand. So talking through what's the difference between quarantining and isolating, and why do I need to think about this in a 2-week parameter? How is this different from the flu? All the questions that all of us had and may have been more easily able to jump online or have other sources of information. We really made sure that we, as a trusted historic source of information for the communities that we serve, really made information widely available to our patients and community members.
Okay, let's hop into something that's a little bit more off topic. I hear you guys are celebrating an anniversary this year. What year is it, and what are you guys doing to recognize that?
So our plans have changed a little bit. We're celebrating 50 years.
Like everyone's, right.
Right. We're celebrating 50 years of service to our communities. So in 1970, this organization was founded really as a grassroots effort by people that were dedicated and focused on improving the health of every individual in a community. We were founded in New York City, and then quickly our insightful board of directors understood that health disparities didn't just exist in an urban population, but in a rural population as well. So by 1975, we had sites in Southern York County and in Hanover. Then over the years, we've expanded more broadly. We had more traditional plans for celebrating. But we've shifted gears and I think a really positive way, and we're focused on telling the stories of both our staff and our patients, and then the communities that we serve. So this fall, we'll be pushing out a lot of the stories that we've collected over the summer, people's memories of the origins of our health center, why we were founded, the importance of our existence in the communities that we serve, and the stories of the people, our patients, some of which we're treating now for 3 generations, which is really exciting, our physicians, our dentists, our nurses, our social workers, their experiences. We have professional staff that come from all over the world and come into our sites to serve the community, to use their skills and talents to make our community healthier. And so telling their stories and focusing on that is actually an exciting way to celebrate 50 years of impact.
Well, not many companies can say that they have been around for 50 years, so congratulations on that milestone for sure.
Thank you.
So, and I wish you well, and definitely you have a tough job moving ahead because it doesn't look like we're getting out of this pandemic anytime soon. So,
I appreciate that, and I'm incredibly grateful to work with a great group of people who, from March 12th ish,
yes,
gathered around. We just got creative, figured out what we could do. Everyone was very dedicated to meeting the needs of our patients. And, even through it all, I have a great group of people that can laugh together, work together, and do good for the community together. So I consider myself very lucky, regardless of the situation.
Excellent. So, well, thank you, Jenny. Thank you for joining us on this little segment of PA Biz Conversations. So you can watch PA Biz Conversations on our website, both for CPBJ, cppj.com, and for lvb.com. So thank you again, Jenny, and thank you everyone for joining us for this segment.